The neurons that control the diameter of the blood vessels are located in the cardiovascular center, which is in medulla oblongata. And the nerves that send signal to the blood vessels to change their diameter exit the central nervous system through thoracic part of the spinal cord and the first sections of the lumbar. So when we analyze the spinal nerves, we see that spinal nerves T1 to T12 and L1 and sometimes L2, lumbar 1, lumbar 2, contain those nerves that supply the blood vessels, and we name these nerves vasomotor nerves. Recall, vasomotor nerves are sympathetic nerves. So during fight or flight emergency situation, from cardiovascular center, signals are sent down to thoracic and lumbar region of the spinal cord, and then from this section, signals will be sent through the vasomotor nerves. When we follow the vasomotor nerves, we see that they're mostly supplying the blood vessels that we have in skin and the visceral organs in the abdominal cavity. And when vasomotor nerves send signal to these blood vessels, we notice that the blood vessels that we have in skin and abdominal viscera constrict. So let's analyze one by one what would be the result of the vasoconstriction of these blood vessels that we have in skin and abdominal viscera. First of all, the neurotransmitters that are released from vasomotor nerves stimulate the smooth muscles that we have in these blood vessels. That's how these blood vessels constrict. When especially arterioles constrict, we know that they significantly increase systemic vascular resistance, and that leads to increasing the blood pressure. However, when veins and venules constrict, they basically push the blood that they have as reserve, they kind of store blood, up toward the heart. So constriction of the venules and veins adds to the volume of blood that veins bring back to the heart. Venous return increases, and we know that when heart receives more blood, it can pump more blood out. So the conclusion is that cardiac output increases, and that's another reason for the increased blood pressure that we experience during a fight or flight or emergency situation. Recall that the average blood pressure is calculated using this formula. If cardiac output goes up or systemic vascular resistance goes up, blood pressure goes up. And in this scenario, that vasomotor nerves stimulated the blood vessels in skin and abdominal viscera and caused their constriction, we made the conclusion that both systemic vascular resistance and cardiac output increased, and that explains why the blood pressure increases. Please note, vasomotor nerves release the neurotransmitter norepinephrine, and we know that norepinephrine binds to adrenergic receptors. And when we analyze the sarcolemma of the smooth muscle cells that we have in the wall of these blood vessels, we see that in the sarcolemma we do have some ligand-gated channels, that adrenergic receptors are part of those ligand-gated channels, and when norepinephrine binds, these ligand-gated channels open, and cations such as sodium ion diffuse into the smooth muscle cell and depolarize the cell. Basically, cell becomes excited, stimulated, and we know that the smooth muscles that we have in the wall of blood vessels have circular pattern. So when they contract and when they become short, they simply narrow down the lumen of the blood vessel, which that would be described as vasoconstriction.